Hello, good evening. For today's demonstration is I'll be doing a male genitalia examination, and this is my patient. Okay, so to start with is we should wash our hands first and after the examination. Okay, so to start with is we will greet our patient. Okay, introduce yourself, and after that one, you ask for his personal information, and you discuss to him the importance of the examination, and um, the rest will follow. Okay, now we will start. Hello, good evening, sir. I'm Crystal Faith Abraham Pico. I'm a second year med student of Davao Medical School Foundation. By the way, sir, I'm in charge for your genitalia examination for tonight, and I would like to ask for some important information, sir. Okay, so may I know your name? Okay, age, address, marital status, occupation, and religion. Okay, thank you for that one. By the way, sir, for this examination, is we will be checking your genitalia and its surroundings. Okay, so the importance of this examination is we will check or we will know for any issues. Oh, okay, or if you have any pain na nafe-feel sa genitalia areas mo, so we can help you by that. Okay, so are you okay for us to proceed the examination, sir? Okay, good. So we will now start. Okay. For the inspection first is um may dalawang option. Either the patient can stand or in a supine position. So for my patient, I prefer the supine position muna tayo. Okay, so for the inspection is I will let my patient lie down, and what we will do now is nakasupay na siya. So, nakasupay ng patient natin. And what we will do is we will cover his chest and abdomen. Okay, we will cover his chest and abdomen. And also, we will place a draw sheet. Okay, we will place a draw sheet sa mid-thigh ng patient natin. So, what we will expose only is the genitalia ng patient. Okay, and the inguinal areas ng patient natin. Skeleton na siya. Okay, expose na yung genitalia. Okay, and then cover na yung chest and abdomen and also the mid-thigh part ng patient natin. Okay, so for the inspection is we will do this one. For the inspection is we will start with the penis ng patient natin. So what we will check sa penis is yung skin, yung foreskin, at saka yung glands. Okay? So for the skin is we will inspect the ventral, the dorsal, the base of the penis. Okay? We will check for any excoriations. Okay, we'll check for any excoriations or any inflammation. So, pag may makita tayo na may mga excoriations sa skin ng penis ng patient natin, then it will suggest for allies or mga scabies sa pubic hair ng patient natin. And then, also, you can ask your patient to lift his penis para makita din natin yung sa likod. Or, if okay sa kanya, you can do the lifting ng penis niya. Okay? And then, also, after sa skin is we will check the prepuce or the foreskin sa genitalia ng patient natin. So, what we will do is we will retract the prepuce or we will retract the foreskin. Okay? So, pag-retract natin, we should detect for any cancers, mga carcinoma or smegma. Smegma is yung cheesy whitish na material na normally makita lang under sa foreskin ng patient, okay? Or sa foreskin ng genitalia ng lalaki. And then, after that one, there are two conditions also sa pag-retract ng prepuce sa patient natin. So, if we will have difficulty na i-retract yung foreskin sa glands, then we will call it phimosis. Pero if ma-retract naman siya and eventually mahirapan tayo magbalik siya, then we will call it paraphimosis. Then it will denote for an edema. Merong edema. Okay? So, we're done with the checking ng prepuce. So, while naka-retract yung prepuce is, we will inspect now the glands. Okay? For the glands, okay? For the glands is we will check for any ulcers, for any scars, any nodules or inflammations naman sa glands ng genitalia ng patient natin. Okay? So, pag may makita tayo na inflammation sa glands, then we will call it balanitis. Okay? Or pag makita naman natin na may inflammation sa glands and the prepuce, then we will call it balanotitis. Okay? So, since we're done the inspection sa penis ng patient natin, then we will retract the prepuce to its normal position na. So, retract mo natin yun siya ganyan. And then, we will now proceed for the inspection ng scrotum ng patient natin. So, what we will do is we will lift the scrotum. Okay? We will lift the scrotum. Okay? Para makita natin yung posterior area or posterior surface. Okay? Ng scrotum, ng each scrotum. So, what we will take note here is lesions, scars. Also, you check for the pubic hair distributions. Okay? So, still the same dito sa kabila. Ganun din, check for any lesions, for any scars, and the distribution ng pubic hair. Okay? After that one, you take note also, re-inspect the scrotum contour. For the scrotum contour, take note also for any swelling, okay? Check for any swelling, mga lumps, okay? Mga bulges, mass bulges, check mo, okay? And then, and also, inspect also the asymmetry ng left and right na scrotum or ng hemiscrotum, okay? Now, we're done with the penis and the scrotum, okay? So, we will inspect now the inguinal and the femoral areas ng patient natin for any bulges. Also, we will note for any erythema or excoriations, okay, sa area ng inguinal or mga femoral areas ng patient natin. Because, if may makita tayo ng mga excoriations or inflammations, okay, sa inguinal or femoral areas, then it will suggest for a fungal infection. Okay? So, since nandito na tayo sa inguinal and femoral areas, we will ask our patient to strain down. What's the purpose of that? Is para makita natin if may bulges. Okay? Now we're done with the inspection, let's proceed for the palpation. For the palpation is we will start with the shaft ng penis ng patient natin. So what we will do is we will use our thumb and the first two fingers to palpate the shaft ng penis ng patient natin. So sa ventral side, we just palpate it. Okay, what you will note is for any indurations or tenderness. By the way, in palpating the shaft ng penis ng patient natin, you ask the patient if may ma-feel siya na pain. Okay? Okay. So, after palpating the shaft ng penis ng patient natin, let's proceed to palpate the each testis ng patient naman natin. So, in palpating the testis ng genitalia, is there are two techniques. You can do it as one-handed technique or yung two hands ang gamitin mo. So, for the one hand, you use, again, the thumb and the first two fingers mo. So, what you will do is palpate each testis, okay? You palpate each testis. Okay, and then, you note for the size, the shape, the consistency, the tenderness, and you also note for nodules, okay? So, still, ganun din sa kabila. Gawin mo din dito sa kabila. Okay? Check for those things. Take note na dapat yung testis is firm but not hard. No, without mass dapat siya. Non-tender dapat siya. Descended, okay? And symmetrical dito sa kabilang testis, okay? And then, after checking each testis, now let's proceed in checking the epididymis. For the epididymis is nasa posterior side lang siya ng each testicle. So, manote mo ang epididymis because of its cord-like feel, okay? So, ma-feel mo siya dyan sa likod. So, i-check mo siya ang each epididymis ng genitalia, okay? And after that one, after sa each epididymis, is you check for the each spermatic cord and the vas deferens naman. So, for the each spermatic cord and vas deferens is still nasa likod sila. Ang sa vas deferens lang is manote mo because it is tubular like, okay? Parang stiff siya pero tubular, okay? Um, do not exert much pressure lang kasi masakit. May ma-feel na sakit yung patient natin when mag-exert ka ng pressure on palpating sa likod. Okay? So, still the same, check for any nodules or swelling, okay? Sa each spermatic cord, the vas deferens, okay? So, after that one, since we're done palpating the shaft of the penis, the each testis, the each epididymis, the each spermatic cord and vas deferens, we will now proceed in palpating the inguinal hernia. So, in palpating the inguinal hernia, is what we'll do is, if magpaping tayo sa right side ng patient natin, we will use our right hand. For the left side, we will use our left hand. So, we will use the dominant index finger natin in palpating sa hernia. So, what we will do is, using our dominant index finger, i-follow lang natin yung spermatic cord. Okay? So, okay, dito tayo sa left. So, we will follow the spermatic cord sa likod. Okay? You follow the spermatic cord upward to move up sa inguinal ligament. Okay? So, move siya sa inguinal ligament until may ma-feel tayo or may manote tayo na triangular slit-like opening of the external inguinal ring. Okay? So, for that one, if ma-feel na natin yan siya, so, each inguinal ring, external inguinal ring and or within the canal, okay, if andyan ka na dyan, you ask your patient to cough or strain down. What's the purpose of this one is manote natin if there are any masses, okay, along the way sa canal or if may masses okay, if may mass na may feel natin sa external inguinal ring. So, that's the purpose na kaya i-ask natin ang patient to strain down or cough. Okay? So, just note for herniating masses. Okay? For that one. Okay? So, we're done with the palpation procedure. So, what we will do now is, you summarize the examination sa patient mo. So, from the inspection down to the palpation, okay, you tell the patient if you note for any abnormalities, if you note for any nodules, if there are any abnormal masses na supposedly is wala. So, you tell the patient sa lahat ng mga na-check mo, okay? And also, you give advice. But the advice naman, since we're done with the inspection, so you advise the patient to meet the other doctors also, or yung mas mataas sa akin na doctor, para mag-give advice sa kanya for any workups na workups na gawin ng patient natin. Okay? And also, you thank the patient after the procedure. And, by the way, throughout the examination, you should use gloves, okay? And after the examination is you wash your hands also. So, that's the end of the male genitalia examination. Thank you.